Hey Zishan, bro, why you're looking so sad?
Yes, bro. You know what? Our teacher taught us this topic today, and truly speaking, I don't even get a single word. These things are very important. Can you please explain this?
Don't worry, I got you. Don't you know I'm a student of Dr. Neil? Come here, I'll explain you. Come here.
Hey everyone, my name is Ishan Gondal. I'm from Pakistan. I'm a final year MBBS student. Dr. Neil, thank you so much for giving me this opportunity. And you know what? I love teaching. I love teaching. So I will explain this concept to my friend and to you guys, the audience of Dr. Neil. So let's go to my study table and let's crack it. So, a new test to diagnose UTI in women is being assessed. The comparison gold standard is positive urine dipstick plus urine culture. Results are given below. So, what we have to figure out like sensitivity, specificity, positive predictive values and negative predictive values out of above given results. So, before going any further, we have to know about some basics. So, what is sensitivity? What is mean by sensitivity? So, sensitivity is the ability of a test to identify the patient that have disease. So let's suppose these all 10 of my clones have disease. So now before any test, you already know that these all 10% have some kind of disease. But now suppose we have a test and this test picks up only 8% that have only disease. Now we can say that these 8 out of 10% are true positive. Also we can say that the sensitivity of this particular test is only 80%. So what about these two patients, my friend? So these two patients are also going to be negative, even though we know they have disease, but this will be called false negative because we know they have the disease but the test is negative. So this will be a false negative. So now let's talk about specificity. Specificity is the ability to identify those without disease. So this is the characteristic of a test in which we have to look for those who do not have the disease. So once again we have 10 clones of mine and they do not have disease. So let's say that we have a test and 7 out of 10 of my clones that are negative. We can say that they are truly negative because they do not have the disease. So we can say that the specificity of this test is 70%, but still there are 3 clones that are positive on the test, but we know they do not have the disease. So we can say that they are false positive. So now let's go back to the case that is given by Dr. Neil. Here we have a 2 by 2 table. So now here in this box we have a patient with disease and here we have a patient without disease. Now let's say that this left column has to do with sensitivity and right column has to do with specificity. The top row of this box is for the positive test. Like you can remember this by mnemonic. Everybody on the top row is positive and the bottom row of this box is for negative test, and you can remember this by mnemonic. Everybody on the bottom is negative. So here in this box the patient is positive and has some kind of disease and the test is positive too. So we will say it's a true positive. But on the other hand, the person does not have any disease but the patient is still positive. So we will say it's a false positive because person does not have any disease but the test is still positive. So we can say this is a false positive. In the left side of the box in the bottom row, the patient have the disease but the test is negative. So we will consider it a false negative because the patient have disease but the test is negative. So we will consider it as a false negative. On the right side, the patient does not have any disease and test is negative also. We can say it's a true negative. So let's make it easy for you guys. We will use A, B, C and D for true positive, false positive, false negative and true negative. So now for the sensitivity, the formula is to divide the true positive by the true positives plus the false negatives. For the specificity, the formula is true negative over true negative plus false positive. And now we already know the comparison gold standard is positive urine dipstick plus urine culture. So now if the patient has a positive dipstick and has a positive culture, then the person is true positive. So now if this person has a positive dipstick and has a positive culture, then this person is truly positive and the person has a disease. And now for the new test, we have to calculate the sensitivity, specificity, positive predictive values, negative predictive values. So now let's put our values for sensitivity. Formula is to divide the true positive by the true positives plus the false negative. So 400 over 400 plus 100. So result will be 88.88%. Now let's look at the specificity. The formula here is to divide the true negative or D by the negative plus false positive. So by putting our values here, which are 450, our 450 plus 50, and we will get 81.81% result here for specificity. Let's talk about positive predictive values, negative predictive values. So first, let's talk about positive predictive values. The ability of a test to detect the presence of disease. And here is the formula for positive predictive values, which is true positive, our true positive plus false positive. Let's put our values here. 400, our 400 plus 50, and we will get our result for positive predictive values, which is 88.88. So now let's talk about negative predictive value, the ability of a test to detect the absence of a disease. So here is the formula for negative predictive values, which is true negative, our true negative plus false negative, and by putting our values, which are 450, our 450 plus 100, and we will get our result, which is 81.88% for negative predictive value. At the end of this video, I would love to give you guys a message. So here is message for positive predictive values. It is a likelihood of having the disease when the test is positive. Remember, likelihood of having the disease when the test is positive. And for negative predictive values, it is the likelihood of not having the disease. So remember these things. I hope you like the video. If you do, please hit that thumbs up button and helps me to win this challenge. Thank you so much, Dr. Neil. Bye bye.